We are glad to present to you our lecture, Radiological Examination of Diseases of the Dental System, Anomalies of Dental and Jaw's Development, and the Traumatic Changes. And we start from examinations. Radiography of teeth. The radiographs can be intraoral and extraoral. When we speak about intraoral type of radiograph, it can be contact and in the bite occlusal. When it is contact, the film is placed in the oral cavity and it is pressed to the alveolar edge with the patient's finger. When that is radiograph X-ray in the bite occlusal, the film is inserted so that its plane is parallel to the bite of the tooth. It is extraoral radiography. We can have isolated images of the left and right parts of the lower jaw. We can take the panoramic view and we can make tomograms. Radiography of the temporomandibular joint is carried out like an enlargement film for each joint separately in two positions, with closed mouth and with the mouth as open as possible. Criteria for normal relationship in the temporomandibular joint: when mouth is closed, the head of the joint is located in the joint cavity outside the articular tubercle. When the mouth is opened, the head is at the level of the posterior anterior surface at the articular tubercle. The articular cavity is free from the head. For optimal visualization of the paranasal sinuses, radiographs are performed in the nasochin projection. The intensity of the shadows of the paranasal sinuses is normally equal to the intensity of the shadows of orbits. When the pneumatization of the sinuses is reduced, their intensity becomes higher than the intensity of the orbits. Hyalography, that is a specialized X-ray imaging which is performed by injection of water-soluble X-ray contrast agents into the secretory duct of investigated gland. Now, let's remind the normal anatomy of teeth. The tooth consists of crown, neck, one or more roots. Inside the crown and root is a cavity that is filled with pulp. The tooth is made of hard tissues of dentin, enamel, and cement. Dentin forms the solid base of the tooth and is contained in the crown, neck, and root of the tooth. Enamel covers the crown of tooth. Cement covers the root of tooth. Normal X-ray anatomy of teeth. On radiographs, the tooth cavity, pulp chamber, looks like an area of increasing of transparency. You should know that the teeth and bones, they are the normal shades. So we are comparing with bone, which is in any case near the tooth, and we understand that something which will be in other color, like here the bone is white, and the tooth cavity pulp is more dark, so it's increasing of transparency. And the pulp is located in the central part of the tooth. The root canal is a slit-like increasing of transparency in the center of the tooth. Dentin forms the solid base of the tooth and is defined as a shade that gives shape to the tooth. The density of enamel is greater than the density of dentin and is determined in the form of a rim along the edges of the crown. The greatest intensity and width of the enamel is on the lower molars. Because dentin and cement have almost the same density, they do not differentiate on radiographs. Features of radiological images of teeth. On the upper jaw, the medial incisors are always larger than the lateral ones. On the lower jaw, on the contrary, the canine has a cutting surface in the form of an angle. The canine's root is the longest one. The first upper premolars have 2 roots. Upper molars have 3 roots. Lower molars have 2 roots. Other permanent teeth have 1 root. X-ray anatomy of the periodontal fissure. The periodontal gap on the radiograph is identified as a uniform strip of increasing of transparency. So here you can see it in black. The tooth is white, the bone is white, and the periodontal gap is black. It is normally 0.15, 0.25 millimeters wide between the root of the tooth and the wall of the dental cell. Age features of the dental apparatus. The child has 20 primary teeth. Developing teeth are located in the follicle. Always during this period, the crown of the tooth is larger than the root. At 5-6 years old, we can normally observe 3 rows of teeth, dairy, those that erupt, and canines, which are often visualized at the background of the maxillary sinuses. The 8th teeth erupt in 18-30 years. Age features of the dental apparatus. The peak of tooth development occurs at 18-20 years. From 20 to 40 years, without changes. From 40 to 60 years, involutive changes. After 60 years, senile changes, osteoporosis and atrophy of jaws. Age features of the dental apparatus. Here you can see the X-ray film with the atrophy of the mandible. You can see how thin it gets. Anomalies in the development of the dental apparatus. There are 2 groups of anomalies of the dental apparatus: anomalies of the jaws and anomalies of the teeth. Anomalies of the jaws: micro, macrognathia, and microgeny, split hard palate. Anomalies of the teeth can be anomalies of the shape, size, quantity, structure, position, and eruption. Retention. The most common type of retention, the tooth is delayed in development and remains in the jaw. Canines of the upper jaw are most often retinated, less often the lower wisdom 8th teeth. even less often the upper wisdom teeth. Retinal teeth can cause trigeminal neuralgia. Here on these X-rays you can see the teeth which are retinated. Two X-ray films. You can see the anomaly of position and eruption, orthopantomogram, and the oblique lateral view, and retention. Anomalies of form, curved root. Quantity anomalies over complete teeth. Fibrous dysplasia. Fibrous dysplasia occurs due to disruption of bone formation during fibrogenesis, manifested from early childhood to 20-30 years. There are three forms: pseudosclerotic, pseudocystic, and mixed. The characteristic features for pseudosclerotic form of fibrous dysplasia are changes in the structure of type of osteosclerosis and increase in bone size due to hyperostosis, as we can see on this axial section of CT. The characteristic features for pseudocystic form of fibrous dysplasia are areas of bone destruction, which consist of cystic formations and increase in bone size due to its swelling. Here we can see orthopantomogram of a patient with pseudocystic form of fibrous dysplasia. For the mixed form of fibrous dysplasia, the signs of pseudocystic and pseudosclerotic forms are both present. Now let's look at injuries of the dental apparatus and facial skull. So what are the weakest points of the facial skull? They are the walls of the orbits, nasal bones, and lower jaw. Lower jaw is due to statistics 80% of facial skull injuries. Depending on the mechanism of action, fractures are distinguished: direct and indirect. Direct occur at the site of application of force. Indirect occurring at a distance from the place of application of force. In the direction of fractures, the fractures can be transverse, longitudinal, and oblique. And here we can see orthopantomography, where we can visualize the fracture lines. Focal points of the mandible where fractures often occur are canine level, corner area, less often the neck of the articular process, even less the coronal process. The more lateral is the fracture, the greater is the degree of displacement. Here we can see again the orthopantomogram with the fracture lines at the level of canine and the corner area. Fracture can be single and multiple. Here on the picture, in anteroposterior view, we can see the fractures in mandible. Intra-articular fractures. Depending on the relationship of the fracture line with the temporomandibular joint, fractures can be extra-articular and intra-articular. Here we can see the axial slice of the computer tomography and also the coronal section. The fracture line, it is connected with the articular space, so that is intra-articular fracture. On this slide we can see orthopantomogram with a comminuted fracture of the left corner of the lower jaw. We are looking at the orthopantomogram like the person is looking at us. Left side, right side. So here the fracture is in the left side. Fractures of the chin bone. Fractures of the chin bone occur due to direct impact. More often they are fragmentary. They can be complicated by hemosynus of the maxillary sinuses. Fractures of the chin bone. Fractures of the nasal bones. Nasal bone fractures are often accompanied by angular displacements. Also can be accompanied by fractures of the processes of the upper jaw. Here are two lateral X-ray films with the presence of fractures in nasal bones. Dislocations and fractures of teeth may occur during acute injury of removal of a tooth or root. There is a rupture of a periodontal tissue and change of position of a tooth in a hole, partial or full dislocation. Here we can see the CT slices, CT in 3D reconstruction, where we can detect the presence of fracture line. Here is a sagittal reconstruction, fracture line, coronal, here is fracture, and axial section, the fracture line. Orthopantomography, we can see fracture and dislocation of the lower lateral incisor, canine and premolar on the left side.